So the answer is D. This is the arteriole. A is an elastic artery. B is a muscular artery. C is a venule. And E is a large vein. Most of the fluid that flows out the arterial end of the capillaries and into the tissues will return through the venial end of the capillaries and enter the venous circulation. A percentage of that tissue fluid will take a different pathway. So most of what we've talked about so far, the arteries, the veins, and the capillaries, are part of the blood vascular system. And the alternate pathway, the one we'll talk about now, is the lymph vascular system. So the fluid begins as extracellular tissue fluid. As lymph passes through the lymphatic channels, it usually reaches one or more groups of lymph nodes. There are very few regions of the body. The back of the liver is actually one of them, where lymph does not pass through at least one set of lymph nodes. And again, as lymph passes through the lymph nodes, it's filtered for particles, and also any foreign proteins are presented to the immune system for recognition. So as we look at the walls of lymphatic capillaries, they're very thin and they're highly permeable. So they're just about as permeable as capillaries. This is because particles, as well as fluid, have to pass between the cells, forming the walls of the lymphatic capillaries. One reason that the passage of lymph through lymph nodes is important in clinical diagnosis is that it can be used to help identify the source of an infection or the source of metastatic disease. So lymph nodes, which are invaded by either pathogens, bacteria, fungi, other microorganisms, or by cancer cells, may become enlarged and palpable, which means that we can feel them. And they can also help point to a source of infection or disease that may not otherwise be obvious. So the particular location of enlarged lymph nodes may give an indication of the presence of disease somewhere else. The other function of lymph is to collect fat from the walls of the intestines. And this fat enters small lymphatic vessels in the villi, which are called lacteals, and from there passes backwards through the veins and into the blood vascular system. So carrying lymph back from the tissue fluids, carrying fat from the intestinal walls are functions of the lymphatic system. Two other concepts that will be important for our study of the musculoskeletal system are the idea of an anastomosis. So an anastomosis is a connection between two vessels. An anastomosis is important because it provides a backup blood supply in case something should happen to a vessel. So if a vessel is occluded by a clot or by a piece of dislodged atherosclerotic plaque and blocks the vessel, in the case of an anastomosis, a collateral circulation, there's an alternative pathway by which blood can find its way to tissues. There will be important collateral circulations around most of the joints of the limbs, and in the case where there's major hemorrhage or a vessel is occluded, the presence of a collateral circulation may rescue perfusion for a particular muscle or other structure. The next important concept that we'll need to see is evident as we look at this cross-section through the limb. So this is an axial section taken at the location you can see, that the layers will be from outside to inside the skin, a layer of subcutaneous fat, a layer of deep fascia, which is a dense connective tissue, and then within that circle of deep fascia, we'll have the major blood vessels, muscles, the motor nerves, and bones. The vessels that are located outside the deep fascial layer will be small vessels traveling to the skin and superficial veins. So this is a network of veins which has no arterial correlates. These are important because they are carrying blood away from the skin, so they're a reservoir from blood draining from the skin. They're also a reservoir for blood that's pumped out from the deeper veins during muscle contraction into the superficial veins. Blood in the lower limb is returning against gravity. The valves in the lower limb are well developed, and part of the mechanism for returning this blood is the force of muscle contraction within that closed fascial space, which drives the blood upwards.